The following podcast is presented by Blue Ridge Production.
Hello, everyone, and welcome to Unpacking the Occupation. I am your host, Trina Esperante, and today our conversation will be all about the terrible twos and why they should be called the terrific twos, and also navigate the famous mom guilt. So, joining me today is my classmate and my fellow T student, an amazing mom to her 2-year-old son. She is learning to navigate first time motherhood while balancing grad school life. And I'm also so excited to have her here. Angelica, thank you so much for joining us.
Hi, happy to be here.
Yay! So, fun fact, Angelica is actually in the same program as I am and is in the middle of completing her capstone project. So I am super, super grateful that she's here with us because I know how busy it's getting towards the tail end of our semester. So, how does it feel now that we are almost done with this program? Are you excited?
I'm so excited. It's a bittersweet moment, I would say. It doesn't feel like 2 years have gone by. I just feel like
Hmm.
I've been on fight or flight mode this whole time.
Hmm.
But it feels good to be almost done. And I can't believe it's like in a couple months, like 3 months, I would say.
Yeah, 3 months. It's
Yeah.
coming up right in August. That's insane. And
Yes.
I know when you had started this program, you had just had your son, or he was a few months. He was
He's
only a
three
few months,
months.
right?
Yeah,
He was
three
three
months
months when
old.
you started. Oh
Mm-hmm.
my
He
goodness.
was, and now he's
And
two.
wow. So, are you getting excited knowing the fact that you're going to be done? You're going to be
Mhm.
spending time with your babies. How does that feel?
Oh, I'm so excited. I feel like, when you're a mother and you're trying to achieve your goals at the same time, it's a little
Mhm.
different compared to your other classmates. But I would say it's a
Mhm.
good different just because you have something to kind of work for rather than yourself. It's more of like a motivation to be like, oh, he's going to look up to me. And I could tell him
Mhm.
in the future, like, oh, I did this while you were 3 months old. And
Oh.
so I am so excited to spend more time with him just because he is at that age where he needs so much more attention.
Mhm.
And obviously, while I spend time with him, it'll give me a moment to study for the NBCOT. So it's best in both
Mhm.
worlds, benefits me, benefits him. And it'll just be good to kind of be home before we start our big girl jobs.
I love that. And he
Yeah.
just turned 2, right?
Yes. Like two
Oh
weeks
my god.
ago.
That's crazy.
Mhm.
Time flies. How has it been watching him grow up and change at this stage?
Oh my gosh, it's been so great. I would say at this stage, his personality just comes out more and more. And also his looks change all the time, so he looks so different. But it's
Mhm.
been really good. I enjoy this phase. It is a little tough because, their personality is just so big, I would say,
Yes.
that you kind of have to guide them in the right direction. But it's been nice to navigate
Mhm.
this stage in his life.
And I know when we were discussing about, his age at 2, I think that
Mhm.
we can agree that terrible 2s and 3s, sometimes 3s, are one of the most common struggles that as parents we can go through. And it's probably also one of the most challenging phases as well, especially
Mhm.
when you're in the middle of it trying to, calm him and, get him grounded. Um, so when you think of terrible 2s, what does that actually look like in your household?
I wouldn't say it's like terrible twos. I would just say it's
Mhm.
big emotions too.
I
Like where
love
they're
that.
trying. I know I heard it somewhere like on the internet, but I don't want to say it's terrible just because he is trying to figure out what emotions correlates with what. And
Mhm.
so I just feel like he just needs a lot of guidance right now, especially with transitions when with the big word no.
Oh, yes. No, the
Yeah.
infamous word.
So that is like the hardest thing right now is just transitions. But I believe the benefit of being in this program and having a whole pediatric rotation and also like field work
Mhm.
for me, it's benefited me in my parenting and it's helped kind of shape how I approach discipline and
Mhm.
transitions.
I love that, and I also
Mhm.
like how you reframe terrible twos to big emotions, and why I'm going back to why it should be called terrific twos instead of terrible twos,
Oh, I
because
love that.
at this point of stage in, your kiddo, it's just a big, massive explosion of autonomy and executive functioning training, and what guides us to understand this concept. And I know, since you are my fellow OT student, we've gone through so many theories and models and frames of reference, but I'm referring to the developmental frame of reference. So it's basically like the map of how kids grow, and they need to, you know, go through this process of big emotions in order to gain those really big skills later on in the future.
Yes.
And,
Yes.
and I really think that that's why what's so terrific about it is because 'cause you're seeing them grow, you're seeing them develop and become these independent humans. So, I know when you had mentioned, he's having a hard time with the word "no," right?
Yes.
Or he's having a meltdown. He's actually following, like, going back to the developmental frame of reference, he's actually following that map perfectly. He's working hard to master those skills of independence, which is exactly what we want for him. And our job as parents, and OTs, is to look at that map and give him the just right amount of
Mhm.
help so he can feel successful without his brain getting completely overwhelmed. So, transitions, moving from one thing to the next, can be so tough at this age. When you look at your daily routine, which transition currently feels like the biggest mountain for you and your son to climb together?
So my son right now loves to go to the park, and
Hmm.
he can go on up and down that slide, go run to the swings. And I would say, like, just the transition of taking him to the car is probably my biggest struggle right now, just because he
Hmm.
wants to keep going and going. But I usually take him before he naps. And for my son specifically, he has a burst of energy before he goes to bed.
Oh,
And
yeah.
that's how, yeah, I'm like, how do you have so much energy before you go to bed? But that's like a huge indicator, like, oh, he's ready for bed. So right
Yeah.
now I'm just trying to find a way to make that transition a little bit easier
Hmm.
rather than grabbing him myself and putting him in the car. I want him to learn, like, okay, it's time to go. We'll be back tomorrow or something like that.
Yeah.
But he is still a little young. Like, he's exactly 24 months, not even like
Yeah.
24 and 3 months. So I know that it'll just come a time. So that is something that I'm trying to navigate right now. Going
Hmm.
back to the whole transitions question that you asked earlier.
Yeah.
Yeah.
So I know when I was in field work, I used a lot of visual schedules with
Yes.
my patients. And so
Yeah.
I would write down a list of what we were going to do today in order, and then at the very end it would be, going to the kitchen to grab some gummy bears. But I had to emphasize they had to complete all of the majority of the items on the list. And setting this visual schedule for them was just a visual reminder, like, okay, I'm working on this activity, the next activity will be this. And I
Yeah.
also implemented timers. My kids love timers, and my son loves timers as well. Um,
Mhm.
do you when you are, on your way to the park, do you kind of give, like, a narrative of, kind of like, I guess, this mental checklist? Or
Mhm.
it could be something, you can implement the next time you take your son to the park.
No, I love how you said that because it just jogged my memory back of the first
Mhm.
Zen board that we learned.
Yeah.
I haven't tried to do that just because he just started doing this like last week. But
Oh.
I'm so happy that you mentioned that because I know kids love timers and they're motivated by time.
Oh, yeah, they
So,
are.
or by the phone, you know.
Yeah.
So
Oh,
I
yeah.
will definitely try to do this um the next time I go to the park. And the first Zen board. Yeah, I'll definitely do that.
Yes, yes, and the park can
Mhm.
be so I know the park can be, like, super fun and everything, and I know for me, right, whenever I have I'm trying to transition my son from his preferred activity, or preferred environment like the park, I would always, give him like a 10-minute warning, like, hey, 10 more minutes, and then we're gonna go get McDonald's, or we're gonna go eat dinner, or let's go see daddy. Trying to
Oh,
find
yeah.
another motivator for him to, oh, okay, like 10 minutes is up, like I have something else to look forward to. And, when they have something to look forward to, they are more willing to transition on their own, instead of
Yeah.
you, like you had said, going there and like grabbing him and taking him to the car. So when he is having these big emotions, right? Obviously, it's very hard for him to organize his thoughts, organize this process. But as you, as his parent, how are you handling your emotions in the heat of the moment?
Oh, I gotta do my diaphragmatic breathing or the box breathing, what we
The
learned in
box
school.
breathing. Yes.
No, it really does help. Just big, deep breathing, just making sure I am
Mhm.
okay and making sure
Yeah.
I'm regulated and at a steady emotional state to handle
Mhm.
whatever I'm
And
about to say to him.
yeah, and you know what sometimes I believe that, us parents can kind of forget is that co-regulation piece where
Mhm,
and I was reading this article where our kids often borrow our calm. So if we
mhm.
are really anxious or if we are really heated, right? They kind of feed off of our aura, and that's when I guess their big emotions become heightened. So
Yes,
something
I love
that
that.
yeah, and something that I've also learned is this method, it's called the pause. So basically it's where you take 5 seconds, right? Where you kind of just, take a step back, take your deep breaths and kind of center yourself before trying to help regulate your child. And I know it's a very small shift, but it's super effective, especially when your child is becoming very, overwhelmed or, just don't know how to handle these big emotions. And so that's maybe one strategy that you can implement at home with your son as well when he is going through these big emotions.
Mhm. Yeah, that's a really good idea.
Yeah. And I love how you mentioned the box breathing and the deep breathing and all of the
Mhm.
breathings. I think
All
those
the
are
breathing.
very all the breathings.
Yes.
I think those strategies can get overlooked and
Mhm.
might be, like it's silly to do some breathings, but honestly, you are reorganizing your emotions to kind of, settle you down.
Yeah, I feel like I try to regulate my nervous system as much as possible, then I just mindlessly start doing it. Like when I'm overwhelmed, I take deep breaths. And
Mhm.
sometimes my husband's like, "Are you okay?" And I'm like, "Oh, I don't notice that I do that. Maybe I'm overwhelmed and I just don't know it?" But your
Yeah.
body just knows what to do, especially if you take the time and practice it.
Absolutely. And do you kind of share these strategies with your husband as well?
Yeah, I feel like I have become a little professor for my husband. I teach him all the things that I learn, which is fun because then he gets OT education for free.
Yay, that's
Yeah.
amazing.
Mhm.
It's really cool that you are sharing these strategies with your husband because I believe when both of you guys are using the same strategies from the toolkit, there's a better outcome of helping your son with these big emotions. I know there's some pretty big milestones coming up between 2 to
Mhm.
3, and that's potty training. Have you
Yes.
guys have you guys thought about it? Have you guys
Yes.
introduced him?
We haven't introduced him yet. I think we could have just like a couple weeks ago, but I'm trying to find the right time just because I
Mhm,
know it is a process where you kind of get it right or you kind of mess up. Like if you do something wrong, then it kind of messes up their whole potty training experience. So I just want to make sure I do
mhm,
it right. Am trying to follow like this 3-day program where I just need to be home 24/7 for 3 days.
mhm.
So we could follow that schedule. So I just have to find like a perfect time. But um my baby has shown me some sign he is ready.
Oh
For
my gosh,
example, he will tell me I'm pooping, but then he likes to hide. and he doesn't like anyone to watch him.
Uh-huh.
Or lately, he's actually been saying, "I'm pooping," and then runs to the restroom, but he just stands up and poops in there. So, yeah, I think he's about ready to get potty trained. I just haven't hit
Yeah.
that phase yet. I have bought like all the potty training supplies, such as like the potty training chart, the
Mhm.
toilet seat, and
Okay.
then, oh, what else? Oh, snacks.
There you go. Positive
Mhm.
reinforcements. That's a
Yes.
really big one. I know
Mhm.
I did that with my son, and we also did the sticker chart, but
Yeah.
he responded very well to gummy bears. So maybe do
Oh,
gummy bears.
he loves gummy bears, so I'll give that a try.
Yes, and then even once you begin to, start this process of potty training, just having him sit down on the toilet, even if nothing comes out, just so he can get that experience.
Mhm.
Um, and also, I know I read somewhere where leaving them without any undergarments and just like a big t-shirt, if they do have an accident, right, they can feel that they don't like that sensation and then
Mhm.
automatically relate that to, oh, I need to go to the restroom. But of
Yeah.
course, I know you had said that there's a whole process and, we want to follow that developmental frame
Mhm.
and not, start sooner than what he's supposed to. I also want to share, there are so many signs that your child will give you to let you know when they're ready, but I do want to share three signs on this episode. So, every child develops at their own pace, right? And there are, three major signs that I think that can help determine if, they are ready to start the process. So the first sign could be they are aware of when they are wet or dirty. So you may notice, your child telling you that they have a wet diaper or hiding when they are need to poop, which I know you said that your son does that, or bringing you a diaper to be changed. This awareness is super important because potty training starts with recognizing what their body is telling them. The second sign is that they can communicate their needs. So, this doesn't necessarily mean that your child needs to speak in full sentences. They may use words, signs, or even gestures like pointing to kind of let you know when they need to use the restroom. So, their ability to communicate helps make the potty training process much smoother. And of course, the last sign, they show interest in the potty or, what other people are doing. So many children become very curious about the bathroom. They may, follow you into the restroom, ask questions, or even want to flush the toilet, or even show excitement about wearing underwear. And interests like these and motivation can be a very powerful indicator that they are ready to learn. And, you know, potty training readiness is less about the age and more about your child's physical, cognitive, and emotional development. So, if your child isn't showing these signs yet, that's okay. Every child gets there in their own time. And I know, we're talking about this developmental frame of reference and, you wanting to begin this process when your son is ready is a really good indicator that you are aware of, you know, where your child is at in this really huge milestone. And speaking of other activities, is there anything that you've noticed he's beginning to be a little bit more independence in? Like dressing or making a snack or, any of the
Oh,
other daily
yeah.
occupations?
Yes, it's so funny because it's like seeing a little man doing chores, but he he's pretty good at dressing. He needs a little bit of help with lower body dressing just because
Mhm.
stability is still a little shaky for him.
Mhm.
He knows how to clean up for himself, but we have to sing the cleanup song.
Okay.
Clean up,
That's
yeah.
good.
Yeah, it's so cute because he's still learning how to talk, so he doesn't know how to pronounce everybody, so he goes like, "Everybody, everybody."
That's so
Yeah,
cute.
it is so cute, and, with feeding, he's still practicing, like, how to be a big boy and completely feed himself for a
Yeah.
whole meal, but for the
Mhm.
most part, he knows how to do, like, the hand to mouth motion
Yeah. Hand to
or
mouth motion.
spoon.
Mhm.
Yeah, hand to mouth motion, he knows to do that pretty
Yeah.
much. Mhm.
Man, and what all I'm thinking about is how I know I had a pediatric rotation, you had a pediatric rotation, and you're, like,
Yes.
implementing all of these things that you learn, and I know you
Mhm.
had mentioned that it's made you look like or it's made motherhood look a lot different in raising
Yes.
your son, and it has for
Mhm.
me as well. What are some, I guess, tips and tricks that you got from field work that you, have been implementing with your two-year-old?
Oh, this is such a good question. So my pediatric rotation, the clinic specifically, was really ABA heavy. So we worked
Okay.
with ABAs a lot, and we did a lot of co-treats with them. And so I would say I learned a lot from them too. Another thing that, or one big thing that they taught me is to, I'm trying to figure out how to word this, but is to really emphasize success. So, like, for example,
Mhm.
you could say, "Oh my gosh, I like how you did this," or, "Oh, I like how you have a calm body. Good job,"
I love
whatever their
that.
name is. And it really works because not only do they get the praise and attention that they usually get when they do something bad, they get it when they do something good. And so when they do
Yeah.
something bad, you don't want to give them as much attention because
Oh,
sometimes these
yeah.
kids really do it for attention, you know?
Oh, yeah. Yeah,
Yeah.
and they're a lot smarter than
Mhm.
some adults might think they are.
Mhm.
So, but that's really good using positive reinforcements, those affirmations. I know I love
Yes.
getting affirmations myself, so I can only imagine how it is for their two-year-old little mind. Okay, well, so I know you've already announced it, that you are expecting baby number 2.
Yes,
Yay!
I am.
Yay! Are you are you excited? I'm sure you are, but,
Oh.
like, going from being a parent of 1 to a parent of 2, how does that feel?
Mhm. I'm so excited. I feel like it'll be a really different experience just because I'm having the opposite gender as well. So I'll
Mhm.
have to learn things all over again. But I'm
Mhm.
excited just because really do love babies and I love the whole parenting aspect of life. And I just
Mhm.
feel like this is where I want to be, you know?
Yeah.
And hopefully, funny fact is that when I was at the open house, like back in February, a girl from our lower cohort, she was asking me how I did it with my son
Mhm.
because she wants to try to have a baby during her program. But then I was so early on in my pregnancy, I couldn't tell her, "Oh, I'm doing it right now." But I was just trying to say, people do hard things all the time. You just got to pick your hard and there's so many of us in this cohort or in this program specifically that are
Mhm.
moms already, or that there were some of us that are already pregnant in the program too.
Mhm.
So I feel like you could do anything you want. But you don't really need to put your life on pause, you know? Like
Yeah,
life
I
just moves
agree.
with you. You just gotta make your
Gotta move
decisions.
with it. I
Yes.
completely understand. Beck, does your two-year-old know that that he's expecting a little sister?
I believe so. For example, he sees my belly and he goes baby and kisses it, but then he also thinks he has a belly or a baby in his belly or in everyone's belly. And so so I think he does,
Uh,
but I think he just thinks it's a normal thing for everyone to have a baby in their belly.
oh my goodness, that's so amazing,
Yeah.
and it's crazy how and I keep going back to this specific age group, right? Only
Mhm.
because their, like, imagination is just coming to life and it keeps growing, and it's a huge part of, them developing, and the fact that he is saying that there's a baby in everyone's belly
Yes.
is pretty, his self-aware of what is kind of happening is emerging.
Mhm.
So that's really amazing to hear out loud. So I know we were talking about the terrific twos and
Mhm.
also talking about your son's big emotions and trying to handle them. I want to go back or I want to shift gears a little bit and talk about this famous mom guilt.
Oh, yes. That.
So how I know. I feel like every mom has a different version of this feeling. So I know when you began this program, right? You were navigating how to manage school and an infant, and you're still trying to navigate this first-time mom role, all while completing fieldwork hours, heavy assignments, and
Yeah.
keeping up with, just balancing other priorities. What are these specific thoughts or, the guilt that tend to come up, and how do you handle those feelings when you get back home?
So I would say mom guilt kind of hit more when I was in field work just because it
Mhm,
is more of like a full-time job, and you can't really control the schedule you're given just because you have to follow your CI's full-time schedule. And so, for example, like I would work 4 10s, and so that'd be like 8 a.m. to 6:30 p.m.
mhm,
And by the time I get home, because it's a 30-minute drive, it's 7, and then my son's bedtime is at 7:30. So I would say
mhm,
it's a little hard on you to transition from, doing a hybrid program, being at home, and then going to a full-time job. And
mhm,
I like how you said that everyone's mom guilt looks different because there are plenty of moms out there that go back to work full time. And
mhm.
so they probably experience this guilt. But I just try to look at the positives and I could tell myself, okay, I could spend extra time with him on the weekend, or I could do this
Yeah.
later, or I actually communicated with my CIs one time. I said, for 1 week, can I work 5 8 instead of 4 10, so I could have more time
Yeah.
for that specific week? And honestly,
Mhm.
just communicating your struggles with other people is really helpful because then they were very understandable and then they gave me that adjustment of schedule. So it was nice.
Yeah. I absolutely love how you said that, spending more time with your son on the days that you have off.
Hmm.
And that's a really beautiful point because there's this saying where it's called serve and return. So basically what that is quality time over the quantity of time spent with your child. And
Oh.
And so by dedicating at least maybe like a day to him, like on the weekend, that one day can mean more to him versus all of these hours you're spending with him because you're
Hmm.
actually dedicating, spending time with him, making memories, and, just having that quality moment with him. And I feel sometimes as parents, we kind of get lost. Like, I need to do this for my child. I need to, we could just get caught up in the moment that sometimes we
Hmm.
forget the now. We're
Hmm.
always thinking, okay, 2 days ahead or, what I could have done better yesterday. But it was actually, living in the moment that is more meaningful and impactful with your child in the present.
I like how you said that just because I feel like I did go through that huge transition where I started to really appreciate the time that I did have with my toddler, and it
Mhm.
just made me more present for the times that I was with him. For example, like I would
Yeah.
not go on my phone.
Mhm.
I would do more active things with him, such as his favorite things as like going to the park. So
Mhm.
yeah, it is like a huge transition with going through this mom guilt, but it also makes you almost a better mom in a
Yeah.
way because you appreciate time in a different aspect.
Absolutely. And I think that's beautifully well said and something that all moms could hear. And also, another thing that moms can hear is that you're doing a great job. All of us are doing an amazing job. and
Yes, we are.
another thing that I want to bring up is that we are in this very rigorous, fast paced program. I
Mhm.
think you can agree.
Yes.
and so, what is pretty cool is that you're actually modeling resilience to your son and you're teaching him, you can achieve your goals by working hard and doing what you love. And I know you had said in the beginning of our conversation that later on down the future, when he's a lot older, you can go ahead and tell him, I did this for you, or I'm doing this for you, and just making it an impactful life lesson for your son. And so when you think about your son watching you work so hard, for your degree, staying up all these late nights doing your assignments, what is one lesson or value you hope that he's picking up or will pick up from you right now?
Oh, that's such a great question, Trina. I feel like that is such a deep question that I feel like a lot of people think about that are in this program.
Mhm.
But hopefully, I model hard work for him that you can achieve anything that you put your mind into. And basically, to become resilient and to not have excuses for yourself, you know? I also want to teach him that you have to work hard for the things that you want and things don't come easy. And basically, not everyone, but I like to live by this. You kind of have to struggle a little to get what you want. Not
Yeah.
everything is handed to you.
Mhm.
And hopefully, that is one thing that he can learn from watching me, you know, struggle on my laptop and crying. I'm kidding. He does not watch me cry.
No,
But
it's
yeah.
okay. That's beautiful. I absolutely love how you said that. And honestly, and right now, I think is the best moment. Like his age is the best moment for him to be seeing all of these things because
Mhm.
I know I hear this a million times. Kids are just sponges and they absorb everything. So, everything that they're seeing, everything that we're teaching them, they are literally taking it into their little brains and it's just developing and growing into something bigger. And
I
I can't wait for
know.
him to comprehend all of the hard work that you've done this far. And I know that it'll be worth it. And I know that's what everybody says. And I really, truly believe that it will.
Yeah, same for you
Um,
and your baby.
so before we end each episode, I like to give an OT tip of the day. And today's tip is called the identity affirmation. In the OT world, we talk about occupational identity, which is the sense of who we are through the things we do every day. When you are starting to feel mom guilt, it's usually because our mom identity is clashing with our student or professional identity. My tip for you today is to practice a role positive affirmation. And instead of saying, I'm not doing enough for my son, try saying, I am a resilient student and a compassionate mom, and why my hard work is a gift to my family. By affirming your value in all of these roles, you're practicing self regulation. When you feel confident and balanced, you're able to show up as the best version of yourself for your child. And remember, you aren't just juggling roles, you are modeling a life of purpose. Well, thank you so much, Angelica, for joining me on today's episode and sharing your story. I really, really appreciate it. I want you to remember that the terrific two phase and these big emotions will pass, and that you are doing a great job, and your son is so lucky to have you. Um,
Oh,
Now, if you guys found this episode helpful, please subscribe, rate, and review the podcast wherever you listen from. This helps caregivers find us, and you can also find more information about my capstone project, podcast updates, and resources on my Instagram, OT with Trina. Join me next time to unpack the why behind the what. Mahalo!
bye.